Hi, everybody. Thanks for coming back. Any newcomers that weren't here before lunch? Okay. So I was asked a couple of questions I want to answer. And first of all was, can just resting affect your HRV? And how can you account for that in terms of knowing what you're doing, in terms of how much improvement you're getting? So basically the best way to do that is, yes, of course, rest can actually affect your HRV. So if you really want to check what's going on, you can, what we do is we have the patients come in, we check their HRV, we have them lie down for 20 minutes, we check their HRV again, and then we deliver the treatment and check it again. So 3 times, and then you can actually account for what's going on in terms of rest. Okay, so that was one question that was asked. Another question I was asked was about, just in general, is acupuncture effective for SVT? Do you know what SVT is? Supraventricular tachycardia. From personal experience, unfortunately, two person, my son had SVT, and we managed to overcome SVT with acupuncture. Okay, so definitely yes, especially early stage of SVT, acupuncture can be very, very effective for that as well. What else? There was another question. Any other questions that came up that you thought about during lunch? Thanks. Any other questions? Yep. 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 Hungry? I don't think so. Not so much. But I do want to discuss that. So hold on a second. Not that I know. Not that I know. So no. But like I showed you. Hold on. Right there. Oh, we're not. Are we getting this?
Switched on at the socket.
There we go. There we go. So let me show you again what we talked about here. Okay, so as you can see in this chart, or what I was showing in the Excels, we see with some of the patients we do see a drop in HRV, and sometimes this is a transient. Do you know, like sometimes you have reactions to a treatment? Patients have more pain immediately after the treatment, and then it kind of subsides and go away, especially during the initial the first treatment or the second treatment. So we actually see that. You see the ones in the red are patients that we had an HRV decrease. So sometimes we actually see that. But as you can see, the majority of patients, especially if you take a look, you have these increases in HRV. And that's one thing. The other thing is sometimes you have a delayed effect. Okay, so we just measured Anne's HRV again. I haven't taken a look at it. But let's see what it looks like right now. Because let's see, before this was before, right? Now we just did. Yeah, before lunch and after the. Yeah, so look at this now. Yeah. So heart rate still remains slower. What was the heart rate? So we started here, 93, 85, 98, 90. So, okay, so maybe what we're seeing here, yeah, is a delayed response, okay? Like I said, normally I would probably leave the needles for like 20, 25 minutes, but what you can see right now is maybe we were in the midst of the treatment, and during the treatment you have this kind of reaction. We still don't know. But if we take a look at the HRV now, especially the RMSSD is much higher, 37, okay? Which is a good response, and the heart rate is still remains lower than it was when you started, which was in 98. So you need to kind of play with this and look at it, but once you do this more and you accumulate the knowledge and your own expertise of using your own tools of checking that, you can actually see, you can see this, you can see these changes. I don't think so. I just had one. Was it a chocolate cake? No, I don't think so.
That's without any further treatment. It's just cake.
Yeah, just cake. Yeah. So maybe maybe since we were doing this after 10 minutes, maybe we caught you just in the slump before the height. I don't know. Okay, and I guess we'll have to do this again towards the end and just see. Normally with patients, after 3-4 times that you take their HIV, you kind of know where their baseline is. But one of the things to do take care of is HIV is best measured for each person at the same time during the day. So if you want a reference point, so we actually try to schedule patients if we can, around the same time during the day for their treatments. Because if you want to compare HIV, it's best to compare it, taking it kind of like within 2-3 hours difference. So if you take early morning HIV and late afternoon HIV can be up to 20 or 30% difference. So it's best to kind of check it around same like morning time or noon time. Okay. Okay. So we did this. And now let's talk about acupuncture for arrhythmias. However, I do have something that I need to start with. Hold on. Oh, where'd that go? I lost the slide. I'm proud and honored and also obligated to invite you to another great conference, a bit far away from here, but still really nice. It's the ICCM, the Israeli Conference of Integrative Medicine. It's in Tel Aviv, and it's March. And I want to show you a really short video on that because it's a happening. It talks about what we do in Israel. So we have like a regular conference built of 3-4 days of conference with lectures and also workshops. So they have like a half-day workshops that we do. But we also, thank you so much. But there's also like a pre-conference hospital, integrative hospital internship that you can take. And we have our annual post-conference trip to Israel, which everybody really likes. So let me show you just a short video on that. Those of you who were not in my class yesterday. want to come and join us? It's ICCM Congress in Israel, March 13 to 15. It's solstice in terms of the days, and it's the best season to come to visit in Israel as well. And like I said, we also have the hospital internship that you can do for 3 or 4 days. You can select different hospitals or different departments. We have integrative therapy and cardiology and orthopedics and gynae and IVF and delivery room. It's like in Israel, acupuncture is very much integrated into the healthcare system, and it's quite an experience to see that. Okay. So let's get back on track. And talk about acupuncture for arrhythmias. Okay, and we'll start with atrial fibrillation. Okay, and again, what we'll do is I'll cover some of the data that we are seeing in the clinic, and then we're going to go. I'm going to talk about atrial fibrillation. I'm going to talk about premature heartbeats. I'm going to talk about permanent AFib also, and then we're going to go over common TCM syndromes and their analysis and their diagnostics and symptoms and major points and herbal formulas that I used. Okay. And hopefully one day we'll do a cardiology workshop, like a 2-day workshop. But this is to come. So atrial fibrillation. So does everybody know what atrial fibrillation is? Okay. So it's a very common arrhythmia. In fact, over the age of 60, it affects. Well, in that recent study that was conducted, that was published recently in JACC, in Journal of the American College of Cardiology, men from ages 45 to 60, the prevalence rate in the U.S. was 13%, okay, which is huge. Now, atrial fibrillation by itself, what happens is you have the atria fibrillating at a rate of around 300 beats a minute. But the ventricles, luckily, the SA node and the AV node actually understand that there's something wrong going upstairs, and the ventricular response is increased, but it's not as high. So atrial fibrillation causes an increase in heart rate, but of course not the fibrillation. By itself, it's not a dangerous arrhythmia at the spot. However, the tendency to develop blood clots, I'm sorry, due to the fibrillation of the atria, sorry, is very high. And I know I shouldn't have had that chocolate cake instead of poppy seed. So these patients get blood thinners, okay, because the risk of stroke is really high because of blood clots. So blood thinners constantly. Atrial fibrillation actually, apart from the fact that it raises the risk for stroke, is very uncomfortable for patients on the rushing heartbeat, shortness of breath, dyspnea, shortness of breath on exertion, difficult sleeping, especially if they have atrial fibrillation. And it comes in 3 different varying presentations. You can have what's called paroxysmal atrial fibrillation, which just comes and goes as an attack, okay, which can last anything from 10 minutes to 24 hours. That's the paroxysmal ones. And then there are persistent atrial fibrillation, which means that you have atrial fibrillation that excuse me, doesn't go away by itself and stays for up to a week, and then you need to go to the hospital and get cardioverted, which could be either through IV medication or through electrical shock to do a cardioversion, because you don't want to stay in atrial fibrillation. Staying in atrial fibrillation really weakens the heart. And then long-term effects or long-term condition of atrial fibrillation is a condition called permanent AF, which is patients that already have atrial fibrillation all the time. They've normally gone through the procedures of ablation therapy, and they're on medication, and they've changed medication, but nothing can be done, and they're consistently inside an AFib state. And in that case, the strategy from a Western perspective is what's called rate control, because they can't control the rhythm anymore, so they just try to reduce the rate, okay? And this is where we can actually help with acupuncture also. So there's actually an interesting study that was published in Journal of the Cardiovascular Electrophysiology Research in 2011, and they were showing that for patients that went this electrical cardioversion in the hospitals, they had three groups: a sham group, a medication group, and a real acupuncture group. Okay, and the acupuncture group, I'll show you, and then and they compared how long. See, the problem with the AFib that it keeps on coming. These attacks keep on coming. So normally within 1 year after an acute cardioversion in the hospital, 70% of the patients will have another episode. Okay? Yeah.
Is this with being fitted with a defibrillator?
Yes, it's done.
You can have an attack again, even if one patient who's been fitted with a defibrillator.
Oh, with patients that have, yeah, you can have defibrillators normally don't treat AFib. They don't use it for, defibrillators, well, there's two types, okay? There's ones that actually kick in whenever your pulse is too slow, okay? And there's one that when you have VF, ventricular fibrillation, which is life-threatening, then it actually zaps you. But they don't, the pacemakers are not used for AFib, okay? The zap, that's to protect him from VF, or ventricular fibrillation, which is life-threatening on the spot, okay? Yeah. So, right, so they were checking how long the effect of the cardioversion lasted, either with medication, acupuncture, or sham acupuncture, okay? And the results were quite astonishing. And acupuncture, what you can see here is the recurrence rate of AFib in percentage, okay, with amiodarone, which was the after cardioversion, okay, with amiodarone, which is the medication, with acupuncture, really similar, with no treatment, and with sham acupuncture. So you can see that no treatment in sham acupuncture, the recurrence rate was high as known, 60 to 70%. With amiodarone and acupuncture, it was about like 20 and 30%, okay? And I think, if I remember correctly, there wasn't a significant statistical difference between these two groups. So this was really a really interesting study. They used a protocol, same for all, okay? It was PC6, it was Heart 7, it was stomach 36, bladder 14, and bladder 15 for this study. Okay. Again, you may want to double check that in terms of the acupuncture ports, but as far as I remember, that's what they were using. You can actually look up the study, and I think it's open to the public, so you can actually see everything in terms of the acupuncture points as well.
Can I just ask about that one? The sham and the no treatment.
Yep.
It seems that the sham acupuncture is doing something more than no treatment. What's going on there?
Well, this is worse prognosis, okay? I don't know if again, statistically, I don't know if there was a difference between these two. Oh, let's do it this way. So I'm not sure that there was a statistical difference between these two things, but in general, what you're seeing here is a higher recurrence rate, okay? So, but I'm not sure that there was a difference here. I know there was no difference here statistically, okay? But in general, the conclusion was that acupuncture was as effective as amiodarone, okay, for preventing AFib recurrences. Oh, and here's the nice thing about this, okay? Oh, that's the best thing. I almost forgot to say that. The drug was taken throughout that whole year, okay? Acupuncture was delivered for 12 treatments only, once a week, okay? So 12 treatments, which means 3 months of acupuncture, lasted almost the same as the drug that was taken throughout the whole year in the recurrence rate throughout that first year, okay?
And how did they do the sham acupuncture?
I can't remember, I can't recall what they were doing there, but take a look at that study. I'm not sure I remember. Sure.
You have given the scores for
12 weeks. 12 weeks. Once a week, 12 weeks. This is, no, wait. 12 months of follow-up for these patients. What's the recurrence rate, okay? 3 months of acupuncture all the way up to here, and then drugs for the whole 12 months, okay? So acupuncture had a sustained, lasting effect beyond the 3 months of treatment in reducing AFib recurrence, okay? And this is a good journal.
And then, can I just ask one question? So what will happen after that? Obviously, there's a mechanical problem.
Yeah, what did you said? What was the end of the question? Mechanical problem?
There's a mechanical problem with atrial fibrillation.
Yeah.
But
What-
what happened after 12 months?
Hold on. I'm going to stop you there and address all. I don't know. They didn't do a longer follow-up for these patients. Okay, but I want to focus on what you just said. There's a mechanical thing there. So please say, why did you say that?
It's just because of the function of the heart.
So.
The blood supply to the heart, apex of the heart, it's all to do.
No, but I'm trying to figure out your thought process. So if there's something mechanical there, then what? Then you would expect.
Something worse.
So are you asking how can acupuncture affect if there's a mechanical thing? I thought that was what you're asking. Okay. So I counter this question a lot. If there's a mechanical thing in the body wrong, how can acupuncture affect mechanical stuff? Okay. Now, we see this all the time. If you have a bulging disc or a ruptured disc, can acupuncture help? It's totally physical, it's totally mechanical. Can acupuncture help? Of course it can help. Okay? And why? The reason is why. And the reason is because there's a lot more going in the area, in the compromised area, than just the mechanical stuff. For example, okay, with bulging discs, okay, there's pressure on the disc, there's inflammation, there's edema, there's the inflammatory soup, there's specificity of muscles. All of these things are contributing to that pain and radiation limited range of motion. Acupuncture addresses the pain, the specificity, the inflammation, it doesn't bring the disc back in, but it reduces, not the acupuncture itself, it doesn't bring the disc back in. You can do that later on with a manipulation, you can do that maybe with Pilates, you can do that with good physiotherapy. But you can reduce all the other effects which are actually the things that are actually limiting by doing acupuncture. Same happens here, okay? You reduce the triggers for an AFib. By reducing triggers for AFib bouts, that's how you're doing that. I mean, so acupuncture has a direct effect on the electrical conductivity in the heart through the nervous system, like we've seen with HRV. Okay, so the fact that there's a physical thing there doesn't matter. Yeah, it's important to okay. I'm trying to figure out maybe if I'm really quick about this recent efficacy, maybe I'll. No, I thought I had kind of off the top of my, okay. So I was going to see if I can find out what the sham treatment was, but I don't have it. So a couple other trials that were done on acupuncture. Recently, medial nerve stimulation was shown to reduce ventricular arrhythmias induced by dorsomedial hypothalamic stimulation. So basically what they were doing here, it's an animal model, they were inducing arrhythmias, okay? And then after inducing the arrhythmia, or before inducing the arrhythmias for some of the animals, they were doing median nerve, i.e. PC, pericardium point stimulation. And when they were doing that, they had decreased arrhythmia. They was more difficult to induce the arrhythmia, or they had short arrhythmia bouts if they did that before that. Acupuncture for paroxysmal and persistent atrial fibrillation, an effective and non-pharmacological tool. So in 2012, there was another review about that showing that acupuncture has we're beginning to have evidence that acupuncture really is good for atrial fibrillation. There's a good literature review on acupuncture for arrhythmias in general in Heart and Lung, which is a very good journal again. And another systemic review which found acupuncture to be positive in the International Journal of Cardiology 211, a systemic review of randomized controlled studies that went over that. Okay. Some of these reviews found inconclusive evidence. Some of them were very positive, but we're beginning to see that there's research coming out there. Any questions? Someone? No. Okay, so let me show you a little bit of our experience with acupuncture and arrhythmia. So I'm finding that acupuncture for atrial fibrillation basically is able to reduce the number of episodes, reduce the severity of the episodes of atrial fibrillation, decrease the intensity of the symptoms, okay? We have patients that actually are suffering less. They still have the AFib, they're shorter, but they have much less of the symptoms, of the debilitating symptoms of the shortness of breath. And we actually have a lot of patients that actually, especially if you caught them in an early stage, that they don't have AFib bouts anymore. So we actually are able to eliminate, at least for our longest follow-up is like 4 or 5 years, and we've seen patients that were clear from AFib for 2-3 years, and then they actually got it again. They came back for another treatment series. It went quiet for another 2 years. So it's a manageable disorder. Okay. We've actually seen 12 cases of immediate cardioversion within 35 minutes of acupuncture. Kind of what they do in the hospital in terms of zapping you with the defibrillator, external defibrillator. Okay, so but the success rate. This is just patients that happen to have AFib when they came to the clinic. Okay, so we don't see them a lot, but when they do come. But I can't say the success rates here are high. I'd say they're less than 50%. Less than 50% of the patients, we actually are able to convert them during an AFib bout. And again, it depends on how long they've had it. The longer, since it can last up to like I said, 24 hours, if you manage to catch it in the first 4 or 5 hours, then you're more likely to be able to do a cardioversion. Yep.
Is this just manual acupuncture, no
Yeah.
electric?
No, this is manual. Yeah, mainly. Those are the points that I mentioned before is the points that they use for the study. Okay. Normally what we do is we just follow TCM diagnosis. Yeah. So again, a couple of examples. Here is a patient with 8 hours of AFib when they came to the clinic. Now, atrial fibrillation has a distinct pattern in terms of what it looks like in the ECG. First of all, you can see the heart rate is high, circled up there, it's 112, okay? And then it's irregular. Can you see how irregular the beats are? Okay, the distances between the beats vary, okay? Okay? And there's also a unique pattern which is called the missing P wave. I won't get into that, which indicates this is AFib. Okay, so this patient has received acupuncture at 10:38, and this is their ECG at 11:38. Okay, the treatment was half an hour, and then we let them rest for a little bit. So this is already normal sinus rhythm. So AFib is gone. Okay, but there's still a couple of what we call premature heartbeats. There's one here, and there's one here, and there's one down here. Okay, but this is a totally different story. This is not AFib. This is premature heartbeats, which we'll talk about in a minute. So this patient is already converted to sinus rhythm, and after another 15 minutes of rest, those VPCs are also gone, and they have a totally normal ECG. Okay.
Heart rate probably is incorrect.
Yeah, heart rate's wrong. Yeah, heart rate's what we saw here. So 62. 62 is the heart rate. Yeah. Okay, and this is only to emphasize how strong acupuncture could be for arrhythmias. Again, I wouldn't tell you that you should be like an on-call acupuncturist for patients with AFib whenever they have AFib. Okay, come get a treatment. Although we did that in the beginning, but since the success rates for conversion are not higher than 50%, I think, then Most of the work is done in between these bouts to prevent these episodes from it's like when you treat asthma, right? You have your patients come in during an asthma attack. Yes, you can help them, but most of the work is done in order to prevent the condition from occurring.
Amos,
Yep.
how long was that ECG and sounds rhythm after the acupuncture?
This is there an hour there?
An hour.
This is 12:05. So, and this is, they started 10:38 and this is 12:05. Yeah. Are you a nurse? Oh, okay. You were, okay. So there's, yeah?
If we're working in between treatments, preventively,
Between what?
if we're working preventively between episodes,
Yes.
do we need to be thinking about moving blood?
It depends on your diagnostics. If you think there's blood stasis, this definitely. If you
So actually most people with when they don't actually have blood stasis as a only might happen.
I'm trying to follow the logic of your question because I'm not sure. You're saying,
Well, it is a danger that people with AF are going to have a struggle.
oh, for blood thinning purposes, do you mean? For blood thinning purposes? Yeah, I see what you're saying. Okay. The question, I got it, thanks. The question was, patients with AFib have this tendency to have stroke due to blood clots. So, do we help them prevent that with our treatment as well? Meaning blood-moving herbs, blood-moving acupuncture? The answer is yes, okay? The answer is yes, I would do that. However, mind you, most patients that have AFib are already on blood thinners, okay? They have to be. The doctors want. I mean, I do get every once in a while. I get these patients that I said, "I'm not taking any medication. I'm just doing just the natural." A bit dangerous there. But then you have to kind of really work with blood thinning herbs and supplements and so on. But in general, they're all on blood thinning medication anyway. And then a question arises: can you needle patients on blood thinners? What do you think? Yes. Of course, yes. Of course. Maybe you need to, when you pull the needle out, press the cotton ball a little bit longer for, I don't know, another 5 seconds, if they tend to bleed. But in general, of course, you can.
Do you have any experience of needing to use the treatment to cope with any of the side effects of blood thinners? Does that influence?
Yeah, but which side effects do you mean?
Well, some people feel very tired from it.
Okay, so definitely. One of the things that we see in our integrative cardiovascular clinic is that we treat patients, many patients come in and they complain, "Oh, I have to take this medication. Can you get me off this medication?" Sometimes we say, yes, we can. For instance, high blood pressure. And sometimes we say, yes, we can. Sometimes we say, no, we can't help you. Unfortunately, you're going to have to take this drug. And they say, okay, can you help me with the side effects? And it says, definitely we can help you with the side effects. And a very common drug that it's taken, the beta blockers, okay? So beta blockers cause people to be very tired because they reduce their heart rate and they don't allow them to go high. They cause cold extremities. For men, they cause a tendency for impotence and sexual dysfunction. And acupuncture actually works really well for management of these symptoms. So yes, definitely, yeah. So here we have another example of an AFib patient, and we're going to 4, right? Oh, am I right? Okay. Yeah. So another AFib patient, they come in 11:51, AFib, pulses 115, irregular AFib pattern on the ECG. This is. This patient, we had him rest for 25 minutes. So you can see after 25 minutes, the heart rate is reduced to 80, okay? But they still have AFib. So the resting did decrease the heart rate, but it didn't do the conversion. And then we treated them, and they switched to normal silence rhythm, heart rate 50, silence rhythm, no AFib. And this is at, what time? Do we have the time here?
13:56.
Yeah, 13:56, starting at 11:51. Yeah. Okay? And this was a patient that came in with 20 hours of AFib when they came into the clinic. Okay, 20 hours of AFib. Okay? Okay, we have another example. I'm just going to skip that because there's a couple more. Let's talk about permanent AFib. So, patients with permanent AFib, you can't convert them. They don't convert them with medication or electric shock anymore either because it just doesn't work. So the only thing that's done is what's called rate management. So rate management is decreasing their heart rate to around 90 for them to be to not have symptoms of dyspnea on exertion, shortness of breath, tiredness, and so on. Whenever their pulses go higher, that's when they start getting these symptoms. So before the treatment, this one has a heart rate of 91. We have a 50-meter walk for them to do, and we have them walk for 50 meters, come back, and then they score their dyspnea on a scale of 1 to 10. So we treat her. Pulse is down to 79. She does the 50-meter test again. She has no shortness of breath, and this is just by reducing the heart rate. Okay. Here's an example of a patient with permanent AF during a treatment series. She has this permanent AF exacerbation. Normally her pulse is around 80 with AFib with the medications, but for some reason something jumped and now she's walking around with 119, which is making it very difficult for her to function during the day. So she has, again, shortness of breath, difficulty walking, difficulty breathing, walking stairs. So this is week 1 before the treatment. You see, we start at 119, we end at 103. Okay. Week 3, she comes in. She's already more stable. 87 before treatment, 80 afterwards. Week 4, 86 before, 77 after. Okay, and basically we got her back to her like normal state, which is around 70. Okay, and this is 4 treatments. Okay, once a week. Yeah, we're going to go over syndrome in a second as soon as we get that, but yeah. But the overall saying is, yes, you treat what you see in terms of Chinese medicine. Okay? So, premature heartbeats. Premature heartbeats, we have 2 types, atrial premature heartbeats and ventricular premature heartbeats. In general, not considered dangerous again when you have them. However, the long-term effect of premature heartbeats, especially if you have a lot of them, is detrimental. More sudden cardiac death, tendency to have more atrial fibrillation. Again, long-term outcomes. People with many VPCs and VPBs have more tendencies to develop other cardiovascular disorders, for example, heart failure. Okay, this is the study that we talked about before. They had decreased HRV in combination with more premature heartbeats. The tendencies to have more heart failure was higher.
What you call premature heartbeats, is that what we call ectopic?
Yes.
Same thing.
Yes, same. So premature heartbeats or ectopic beats are beats that actually arrive before the normal beat. They precede the normal beat, ectopic beats. Well, it has to be ectopic, because there's also ectopic activity for AFib, but this is different. But, so if this is the normal ECG, okay, normally what people experience is this. They feel, either they feel all of a sudden that there's like 3 or 4 rapid beats that come, or they feel that there's a skipping beat. They feel like there's the bit there, a skipping beat. Now, skipping beats can be, basically what happens is you have a beat which is premature, and then the next one is longer afterwards, so that there's like a pause in the heartbeat, and that's what people are feeling. They're feeling the pause, and after that you may just feel a pause, and you feel this uncomfortable sensation in your chest, or it can be after the pause you may have 3 or 4 fast beats.
So could you say this is like
Yes, but some palpitations are just, if I would scare someone, they may also suffer from palpitation, but it's not a VPCs. But VPCs palpitations can manifest. And Chinese medicine has a very long-standing history of treating palpitations, okay, of different types. But yes. So this patient again, 12:45 before, 1:15, so that's 30 minutes afterwards. VPCs are completely gone, okay? So this is before, this is after, gone. Now, how long does this last? Well, they come back next week. They still have VPCs, but they have less. And they do another treatment, and they have less. And over time, what you're getting this accumulative effect when they have less and less. And eventually, the way this is tested is by a 24-hour Holter test or 24-hour ECG that they carry, that they wear. And you can see here this patient right here, when they started, okay, they had VPBs, ventricular premature beats, 10,000 in 24-hour ECG, and then after 12 weeks, none. Okay, and this is like the gold standard test for how many VPCs or VPBs patients have. Okay. There's another example. This patient has 4,000 VPCs and 7,000 APCs, atrial premature complexes. So this is ventricular premature complexes and atrial premature beats, okay? So 4,000 and 7,000, and this is after a treatment series non-detected, okay, 0 over here. So this means non-detected in Hebrew. All right? So acupuncture is extremely effective for premature heartbeats. If we take a look at our accumulated data of what we've looking at in one of our small studies, in-house studies, so 28 patients that received a total of 140 treatments altogether. We see that their heart rate was reduced from 73 to 67. And you see the mean premature atrial complexes, which was 15 a minute, was reduced to 5 a minute. And the mean pre-VCs, which was 10, was reduced to 6. Okay, and this is like a group, in a group, and you can see the p-values here are significant. Okay, we're still, conducting this and collecting this, but this is, again, acupuncture is really effective for that. Here you can see Holter ECGs of several patients. The first patient on the left was an unsuccessful treatment. So she had 20,000 VPCs when we started, okay? It was down to 16. It's still not good enough. 16 in 24 hours is a lot. Above 12,000, they actually would like the patients to get ablation therapy for that. So again, from a limited experience that we have, we see that whenever we're around these numbers, it's more difficult, okay? But 11,000, 4,000, 7,000, look at these people, okay? 11,000 to 0, 11,000 to 0, 4,000 to 0, 7,000 to 0. So with around the 10,000 VPCs, APCs per 24 hour, we can still help them a lot. So let's talk about common symptoms that we see in practice, okay? So we started the lecture this morning with discussions on the Juayin system, right? Remember, we talked about the Juayin system, the liver, and the pericardium, Juayin system. And the liver, pericardium have these two aspects of yin and yang that we always need to consider: the qi aspect and the yin, the qi yang aspect and the blood yin aspect. So common syndromes with the palpitations and that we see, as you can see, I'm putting a lot of emphasis on liver, on liver, okay? We also see heart and kidney. We also see spleen qi and heart blood deficiency and heart yang qi deficiency. I'm just saying that these are less common. This is much more common. This is why I'm going to focus on these syndromes, okay? So we've discussed the etiology. The yang aspect is qi, emotional aspect of the liver and pericardium protection. The yin aspect is blood, nourishing and protecting aspect of the pericardium. Okay, and again, we've also discussed that the pericardium, anatomically, Western-wise, is the location of the SA node, the AV node, and also a bunch of ganglionic plexi, which are nerve plexi or nerve clusters, which are called the ganglionic plexi, which sit on the pericardium and have to do a lot with arrhythmia and atrial fibrillation. Okay? All of these entities are sitting on the pericardium. This is why liver pericardium is so important from a Chinese perspective. So common symptoms that we see with liver qi stagnation is palpitations which are worse or originating from emotional distress. This can be anger, this can be stress, excitement, or anxiety. With women, worse before menses, where the liver qi is more stagnated. Chest oppression, chest congestion, repeated sighing. Okay, are you familiar with that in the clinic? Did you see your patients go? What is that? Why are we doing that? Trying to expand the chest. Liver qi stagnation. Remember, the liver channel goes all the way in the flank area. So compressed liver qi actually tightens up the muscles between the ribs. So the intercostal muscles are more tight. Just like liver qi stagnation can cause neck pain, it can also cause what we call hypochondriac pain, is due to increased specificity of the intercostal muscles. So when these muscles are pressing the rib cage, you have this contraction. People are feeling like it's difficult to bring air. Okay, so what you see as a response is that they take these deep breaths of air, but normally what you hear is the exhale. So you ask, whenever you hear that, you ask your patients, do you get a lot of those? And they say, a lot of what? A lot of what you just did. What did I just do? Well, you just did this. Okay, so that's a classic indication of liver qi stagnation affecting the chest and rib area, and your point combination will have to address that to open this up. So you would use points like PC6 together with gallbladder 24 or liver 14 and CV17 in order to expand the chest and relax that area. Okay. So chest oppression sign, difficult to get air into the chest. Okay, and often they're really scared, especially cardiovascular patients or patients with a history of cardiovascular disorders. They say, I have this, I can't breathe, I don't have air. And they think it's like heart failure or something. And it's really alarming for them. And I ask them, well, is this you can't breathe when you walk or try to climb stairs? He says, no, it's just when I sit there, especially after I sit there for a while, I feel I don't have air. Okay, so first of all, you need to relax them and calm them down. This is not heart failure. It doesn't have to do with your heart specifically. It has more to do with the intercostal. You tell these patients that it's just about relaxing the chest. And acupuncture works magically for this. Just doing PC6, CV17, liver 14, gallbladder 24, really open. I mean, they feel it within minutes. They go, I can breathe again. Okay, because it's just tension and specificity in the chest area. So really works really nice. So you may have a tight pulse, or you may have a tongue change, maybe or maybe not. Strategies would be smooth the liver, spread the qi, open the chest and channels, calm the shen, and circulate blood. Okay, so we use these points: PC6, liver 3. PC6 gallbladder 34 is also an excellent combination for affecting the flank area. And then liver 14, gallbladder 24. And for calming down your patients, I always like to use either GV20 or yin tang. Excellent points for just relaxing. Okay? So that's generally with liver qi stagnation. Now, when you have liver qi stagnation, which is accompanied by heat, which is very common, okay, you may have heat or burning sensation in the chest or flank area. There's more irritability, more anger, more red complexion, red face, maybe stuff with the eyes, redness in the eyes, tendency of this liver fire or liver heat to go up, more sweating, worse with warm weather, preference of cold food, and so on. So the classical heat symptoms, okay, they may have that bitter taste in their mouth, or they may not. They may maybe have dizziness. They have more nightmares because when the heat enters the pericardium, it actually disturbs the shin more. Okay, vivid dreams or nightmares. You may have a full and rapid tight pulse and a red tongue. Okay, so apart from the points that we discussed before, you can actually add heat clearing points like these ones. PC7, liver 2, excellent points to clear heat from the Juayin when you have heat there. Okay, if this heat is spilling to the Shaoyang with things like dizziness, headaches, high blood pressure, blurred vision, okay, then you want to clear heat from the Shaoyang system by using points like Sanjiao 5, gallbladder 41. Okay, other points for clearing heat are Li11. Or you can use spleen 10, which cools the blood, which reduces heat, and you can use stomach 44, which is also a very heat-clearing point. Now, often if these patients have long-standing heat and liver stagnation, they've started to consume liver yin and blood. Okay, and this heat consumes liver yin and blood, then you want to use points to nourish liver yin and blood from the Juayin channel, like liver 8 and liver 3. Okay? Main herbal formula for that would be Longdan Xie Gan Tang. Anyone familiar with that? It's Longdan formula for relieving fire from the liver. And you can also use Jiao Wei Xiaoyao San, okay, a relaxed wanderer. Yeah, question?
You don't use Higu or Li4 at all?
Do I use Li4?
Because I
You can use, yeah, you can do.
I would think it's very useful, but you're doing...
Yeah. I use, you mean the 4 gates?
Yeah.
I use the 4 gates, but it's for a very specific thing. Normally, it's not like the first thing I would use here. I want to do like a direct effect on the liver pericardium. But 4 gates is a very calming combination. It's a very strong combination, but it's just that, yeah, it's a general combination. And normally we use 4 gates when we are stuck in a treatment. So our treatment series. Not so much here.
Did you have a formula for the first...
That was the first one was general liver qi stagnation, then we're breaking it down. So maybe Xiaoyao San, first formula, this one. Yeah. When you have liver qi stagnation with blood deficiency, then you start seeing these classical blood deficiency symptoms. Patients are much more tired, pale complexion. This is like being tired that doesn't get relieved by rest, right? Because you have blood deficiency there. They may or may not present symptoms of anemia, meaning hemoglobin may be reduced or maybe not. You should also take a look at B12. You should also take a look at folic acid and vitamin D. These are all things that can indicate liver blood deficiency as well, measurable liver blood deficiency. So liver blood deficiency can be in the realm of energetics showing nothing in the blood tests, but a lot of symptoms in terms of Chinese medicine. But it can also be in the realm of measurable blood tests, like with these like reduced iron deficiency, ferritin may be low, like I said, B12, folic acid, and hemoglobin. Okay, but again, it doesn't have to be there. It doesn't have to be measurable. They can have all the symptoms of classical liver blood deficiency without any blood test changes. So poor memory, poor concentration, dryness in the eyes, poor nighttime vision. These are all symptoms of liver blood deficiency. Deteriorating eyesight, nails may be brittle, more dryness in the skin. There can be more hair loss or tendency of hair loss with women. Symptoms are worse after a menstrual cycle. Postural dizziness, that's a classic symptoms of liver blood deficiency. You know, if you get up really fast, what happens? Oh, I never get up really fast because I'll get really dizzy. That's also one of those classic liver blood deficiency symptoms. Okay. Again, the insomnia and vivid dreams, and pulse may be thin, may be empty. Pulse, the tongue may be pale at the sides. So you want to nourish blood, calm the spirit. I like to use on the back the bladder shoe, bladder 18, bladder 19, and also the Huato points near that. So I do all like 3 needles, Huato in the 2 bladders and Huato in the 2 bladders. So do like a line of 3 needles on both sides of the spine. Okay. Again, classical formula will be Xiaoyao San. And then you can add Siwutang, which is a formula that that strongly invigorates. But are you familiar with these formulas, right? Xiao Yao San, right? 6 herbs. By, well, you can buy them patent. There's patent herbs for those, I think. Oh, you can only no wait, but you can build them, right? Yeah, better, even better, much better, right? So you prescribe them as granules or powders, right? And then you have your Baiju, Fuling, Chai Hu, Dangwei, Bai Xiao, Bo He. You have all these herbs, right? Su Tang, Dangwei, Bai Xiao, Chuan Xiong, Shuli. You have all these herbs here. So just, build these formulas for them. It's even better. It's more personalized. When liver stagnation is damaging or is in conjunction with a middle jiao deficiency, then you have palpitations which are worse after a meal. Okay, this is very common, actually very common. Okay, arrhythmia worse with food is very, very common. So, classic symptoms of middle jiao deficiency: loose stools or constipation. They're more tired, indigestion, stuff which is worse at night, difficult falling asleep, overthinking, poor or high appetite, pale complexion, easily bruising. Again, symptoms of like spleen middle jiao deficiency. Pulse may be weak or empty at the middle jiao positions. Tongue may be pale, may be swollen. Then you want to tonify qi, strengthen the middle jiao, calm the shen, but also smooth the liver qi. Okay. So, and then we use points like PC6, stomach 36, stomach 37, which is a good point as well, CV6, all these tonifying points, right? I find LI10 and stomach 36 a very good combination for tonifying the middle jiao. You can use heart 7, spleen 6 if you have these liver qi stagnation, spleen qi deficiency, heart blood deficiency syndromes. Sometimes they go together, spleen qi, heart blood, then heart 7, spleen 6 works really nice. Again, back shoot points of the spleen and stomach, UB20, 21. And I find GV21 a very uplifting point rather than GV20.
Why would you use stomach 37, stomach 39? Why would you use that?
Actually, you probably more use it for constipation, because it's a lower Hersey point.
Because it's reducing the heat then?
Yeah, constipation and also building blood if there's like blood deficiency there.
37, 39?
Yeah. 37, 39, yes. Lower Hersey points. And also sea of blood points, right? Yeah. Okay, when you have liver qi stagnation with a gallbladder and chest qi stagnation or gallbladder dampness or gallbladder heat rising, then you have these palpitations which are worse after food, especially heavy or greasy food. You have nausea. Nausea is a key symptom. Listen, whenever you hear nausea, you want to think Shaoyang. I don't know if you guys think of this automatically. In your differential diagnosis, the word nausea should always ring 2 bells: stomach and gallbladder. Always, 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 always. So if you're suspecting gallbladder, start asking questions about other gallbladder symptoms. For example, other Shaoyang symptoms: dizziness, tinnitus, vertigo, headaches, migraines. Whenever I hear that, I want to rule out Shaoyang. Okay. So nausea is a classical symptom of gallbladder from a Western perspective as well, right? No, we have nurses here, right? So, or not, yeah. So always remember that nausea is just a stomach thing. It's also a gallbladder thing, okay? So again, this chest oppression, shortness of breath, migraine headaches, all these symptoms of heat rising up the Shaoyang, like eyes or ear problems, recurrent sore throats. It's like evil's stuck in the Shaoyang. Recurrent nose problems, again, dizziness, anxiety, gallbladder, so fear, fright, long-term emotional trauma, history of stuck diseases, okay? Something that they caught and didn't completely recover from. And then there's all these classical Shaoyang syndromes like mononucleosis, chronic fatigue, fibromyalgia, all these things that are stuck there in the fascia, in the tissue, and the Shaoyang, which is Shaoyang is the governor of spaces, and also as governor of spaces, the Shaoyang is the governor of fascia. This is why gallbladder 34 is the command point of sinews and tendons. Okay, Shaoyang dominates gap spaces. I used to wear this Mind the Gap shirt for these lectures, right? you really should mind the gap, and the gap is the Shaoyang. Shaoyang really, really is the dominator of gap spaces, and especially the fascia, which is in all the gaps. Okay.
Do you need to check blood pressure for these patients?
I normally do. Well, I normally check blood pressure for all patients when on their initial visit, almost.
Do you change the whole formula accordingly? Like, is it okay to give Shai
Yeah. Oh, you need to follow that, but yeah. If the diagnostics is correct, you can give Bu Zhong Ichi Tang for high blood pressure as long as they have sinking spleen yang qi. That's if you see my yeah.
But stuff like ginseng, you wouldn't keep for high blood pressure? Or okay, dosage?
Interestingly, ginseng in low dosages reduces blood pressure. High doses increases blood pressure. So if they use 1 or 2 or 3 grams a day, or 1 or 2 grams a day, excellent. Yeah. So you're harmonizing the Shaoyang, circulating chest qi, opening the chest, and working on counterflow qi. Again, the PC6 gallbladder 34, excellent combination. Sanjiao 6 gallbladder 34, excellent combination if you have qi stagnation in the Shaoyang, manifesting as liver qi constipation, manifesting again as this flank pain, this nausea, this irritability, or this restlessness in the body due to stagnation. Okay. Other points could be gallbladder 42. Again, CV17 to open and expand the chest. CV12 is a wonderful point to harmonize the middle jiao, especially in these conditions, where you have more excess. Back points of the liver and gallbladder. And again, this syndrome, the main complaint with this syndrome is this chest oppression, okay? So chest oppression, flank and chest oppression is like the key symptom here. So these are, again, the patients that have this repeated sighing and this shortness of breath, and you're trying to help them expand the chest, okay? So this form is called Gualo Xie Bai Ban Xie Tang. It's just 3 herbs. But all these 3 herbs expand and open the chest, just like PC6 and gallbladder 34 and liver 14. Yeah.
Is there a phlegm element to this?
Is there what?
Phlegm or
Yeah, it's a classic. Well, these herbs in general are classical. They're from that category, but they're used in China for expanding the chest. Yeah, yeah.
you don't use things like Chen Pi?
Yeah, definitely. Chen Pi as well. Yeah. Gualo Pi, Xie Bai Ban Xia Chen Pi, of course. Eugene. Okay, one of the major herbs for the flank area, if you realize. Eugene, do you know Eugene? Yeah? Okay, excellent herb for relieving the stress. Okay, and if there's a lot more phlegm, then you can use Urchin Tang or Wendan Tang. These are formulas which are, Chen Pi Ban Xia Fu Ling Gan Cao.
So they'd be stickier on the tongue?
Yeah, stickier on the tongue, more symptoms of, these headaches, these foggy sensations of like dampness clogging the Shaoyang. They may have actually physical phlegm that they come out with.
Do they have a bit of a belly?
They could, but they don't have to have. They could, yeah. Do you like mine? No. So Urchin Tang, right? Chen Pi Ban Xia Fu Ling Gan Cao. Wendan Tang, which is Urchin Tang plus Ju Ru Zheke. Okay, these are excellent herbs. All right. So right before that demo that we have for the next 20 minutes, yeah. So we're going to do, we have people with arrhythmia here, right? They've told me that they know that they have arrhythmias. Yeah, what do you have?
I did that
You did?
about a couple of months ago, but it seems to have gone now.
Okay. So we don't want to, I'm just kidding. What was it, do you know? Did you get it diagnosed?
I did a 24-hour,
Uh-huh.
but it came back. They weren't
Negative?
interested.
Okay. Probably just premature heartbeats, and that's why they weren't. Anyone else? Yep. Anyone on you? Tell us what you have. We don't know exactly, do we?
No, but it manifests like premature heartbeats, but it's some sort of hereditary condition that
Okay.
on an ECG looks a bit like atrial fibrillation.
And it's not constant.
Yeah,
We'll take your ECG. We'll take a look in a second. Okay. Who else? What do you have?
Apparently since birth I've had every so often a missed beat that's constant about every 20, 25 beats.
So you have them all the time. Okay. So let's do a 2-minute ECG for you as well. Okay. So we'll take a couple of ECGs and we'll do a couple of treatments and we'll see. Some of you will do sitting up. Some will do that. You can come close if you want. I just want to say before we end, because we're going to end after this, that some of you were in my class yesterday. I'm coming back in 6 weeks exactly to London to teach a weekend class. It's going to be the wave acupuncture, channel theory-based acupuncture that we use. Some of you have already taken that class. And it's a wonderful hands-on, practical class that you can really, you come on Saturday, Sunday, and you can use it in the clinic on Monday. Is this true? Yeah? Yeah. Seriously, it's that. So 6 weeks from now in London, it's the City College of Acupuncture. I have brochures here. You can take a look at them, and I hope to see you there. So let's do this. Let's see if we can get. Can you hold this? So we're going to put your fingers like this. 1, 2, and I just want to hold it like this.
Can I ask you a question while you do it?
Yep, sure.
I have a patient with Takotsubo.
With what?
Takotsubo syndrome.
I don't know what that is.
Well, it's stress-related.
Oh, it's chest-related tachycardia. Okay. Yeah, excellent.
She has to go into hospital to get checked because the body produces a particular substance which is risky for her. I thought it would be done something.
Okay.
I mean, would you just treat with that as
I would treat her, definitely. I think you can help her a lot.
just with your usual diagnosis?
Yes. Yeah, but mind take, what's that? IgE, okay. Yeah. So you may, just take a close look at the liver pericardium system. So yeah, right now, this is normal, so we're not, but let's do 2 minutes, okay? Any other questions? Yeah, go ahead.
You mentioned about getting the slides. We need to do an email list for that.
Yeah, did you get the email? We've done that. Yeah, we did that before. Anyone didn't put their email and they want to get? Yeah, so I have the list here somewhere. So, who needs this? Your question? Yeah. Hold on a second. Let me hear this question. Yeah. Shh. I want to hear a question. Yeah.
I trained 25 years ago when none of this technology was present.
Yep.
So I remember being told that the cardiovascular diseases module at the time that irregular pulse is okay, regularly irregular is dangerous. Comment in terms of this.
Yeah. So what you've learned 25 years ago is still very accurate today as well. So yes, of course. When you have any kind of arrhythmia which is presenting at a very regular rhythm, it's actually more. It's more. No, it's not so. It's more stagnant. Okay. So it's a little bit more difficult to overcome, but still can be overcome. Okay. I'll show you an ECG of a patient just from a week or two ago. VPCs every fifth beat. regularly, every fifth beat regularly, and then after the treatment, reduced completely. But in general, yes, you can say that when they have regular rhythm for arrhythmia, then it's more complex. It's true.
What was the herbal formula for liver qi stagnation with middle jiao deficiency?
Oh yeah, it was Xiaoyao-san plus Shengmai-san. I'm sorry. Yeah. Yeah, can you see these here? So this is APCs. You can see the difference here. See, regular beat, regular beat, regular beat, and then longer, right? Can you see that, or not really? Yeah. So that's an APC. Yeah. Actually, when you zoom out, it's actually easier to take a look at. So okay. So I'm going to check someone else and then I'll ask you a couple of questions and we'll see what kind of treatment we want to do. So if we get to do the treatment, excellent. If not, I'll just say which points I would do for her, okay? Let's check your ECG. Yeah, can you let go of that for a sec? You don't want anyone to flatline here, right? Or suspect they're flatlining.
Like this?
Yep. And just gentle touch. Any other questions? So let me ask you a couple of questions about. So when do you experience your? Do you ever feel it? Do you ever feel the palpitations or? Sometimes.
And that would usually be when I was tired.
So when you're tired more, okay? And would you say this happens normally towards the end of the day more? Yeah. Do you ever get them more after food? Or not necessarily?
No, I don't.
So evening time or nighttime?
Evening.
Evening time, okay. So when you sleep, you're okay. You never wake up feeling palpitations or anything like that? Not really?
That would be rare.
Rare. And you say you've had this for years, right?
Yeah.
Okay. And tell us more a little bit. In general, what do you do?
I want to say I'm an acupuncturist. What do I do?
Full-time?
Full-time acupuncturist, yeah. And
Okay.
trainee priest.
Okay. So,
It's rock climbing and indoor skydiving.
okay, wow, okay. Indoor skydiving, rock climbing. This is important information. What does this indicate in terms of demeanor, right? So, the tendency for extremes. What do you think? Huh? Yeah. What do you think?
Yeah.
Indicating what?
Oh, sorry.
So if someone has this tendency, okay, yeah, you need to kind of break up stagnation vigorously, right? Yeah. Okay. What else would you think? Tendency for the extremes. You're saying
Too much young. I just was thinking water's there. But,
so lacking?
well, no. I just
Oh yeah.
forget it. It's fine.
No, please elaborate. I mean, we will. So 5 element is water type, or is it?
Yeah, I just thought, the extreme stuff, no fear, just
Mm-hmm.
water, overdoing it maybe.
Okay. So from 5 elements perspective, we'll say water type. Okay. Oh, okay. Yeah.
So she needs water then.
Yeah. This is what I was asking. Okay. Do you tend to be more hot or cold?
Hot but cold around the edges.
Cold on the edges, but hot. What does that mean? What does that mean? So this liver qi stagnation may be creating heat. However, when liver qi stagnation is apparent, you have cold extremities, right? The circulation is poor on the extremities, so it's really hot in here, manifesting in slightly red cheeks that you can see, right? So some liver qi stagnation, maybe some heat. Okay. Menstrual cycle?
Yes, regular.
Regular? Any pain? No pain. Okay. Short?
Shorter than it used to be.
Okay. So we're done there with the ECG. We're just going to take a look. Okay. Yeah. So you see these are premature heartbeats. You can see them here. You can see one here, and you can see one here. Quite a few. Let's count them. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. I picked up 15 in 2 minutes, so 7 in a minute. So 24 hours would be a lot. So definitely. So we'll do an short intake for you as well. Okay. So I'm thinking maybe symptoms of liver qi stagnation and maybe symptoms of heat. Any discomfort around the flank area? Any sighing? Any
On the right side.
on the right side? What do you feel?
Well, in Northern English language, we would say get a stitch quite often.
Okay.
So
Okay.
just
Hypochondriac pain is what the Chinese say. Okay.
a
Okay.
stitch.
Yeah. So yeah, it seems like there's some classic indications of liver qi stagnation. Let's just quickly take your pulse and see if we are getting there. Yeah. So cold hands. Can you see your tongue? Okay. Tongue is swollen, has a thick coat on one side, missing coat on the other, a little bit pale. So see it again? And some tooth marks. Yeah. How's your digestion?
Yeah, if I eat too much, I just...
So it changes. Sometimes it's good. Sometimes it's
Yeah.
So changes in digestive and bowel movements often indicate liver qi stagnation. Because liver qi stagnation is not always there. When you have stagnation, then it may affect. When you don't have stagnation, qi stagnation comes and goes. Right? It's not a permanent
Do
thing.
you take any herbs? Do you take any herbs?
Not at the moment.
Oh, that's a great question. Vegetarians, what do you think? Arrhythmia and vegetarians. What?
Deficient blood sugar and qi deficient.
I agree.
I'm vegan.
I see a lot of patients. Okay, here's my take on vegan and vegetarian. I think any nutritional plan or trend or whatever never works for everyone. Okay, that's the beauty of Chinese medicine. Differential diagnosis is the key. If you have liver blood deficiency and you're off proteins and you're not eating meat, and that you're creating damage. However, if you have excess DAP phlegm stagnation and you become a vegetarian, it's excellent for you. So it has to be specific. It's like this good for everyone kind of trends in nutrition. I see the damage, and I see so many women with blood deficiency that have turned vegetarian or vegan and started having arrhythmia from that. It's very common. Okay, I see that a lot. So unfortunately, if we can, we have them, move back to limited meat, and if they can't, at least make sure that they have enough proteins. So definitely, I've seen like 4 times. In Israel, during springtime, it's very common people go and do these liver detox retreats, okay? When they drink only green shakes for a week. I've seen 4 patients that have had AFib start during those retreats. And guess what they had from a Chinese perspective? Severe blood deficiency to begin with. So this one thing fits everybody that just doesn't work. That's the whole beauty of Chinese medicine, differential diagnostics. Okay, so yeah, we're seeing liver qi stagnation, some heat, but also some, I don't know if it's liver blood deficiency or some yin deficiency symptoms I see also. Do you ever get warm at night or?
Yeah, sometimes not as much as I used to.
Okay.
Because of acupuncture and herbs from this one.
So in terms of what we would do here, I would probably do a PC6, liver 6, liver 2, PC7 to clear some heat, and then also nourish some blood and yin. So maybe also kidney 6, maybe liver 8. Okay, but first we would do more clearing of heat. So I would start with PC6, PC7, liver 2, liver 3. Could do, yeah.
Or one.
No, probably together. I would probably, normally, what's that?
Would you consider treating shower young at this point because of the unilateral time?
I see that this is also, it's not just a Shaoyang, it's also a liver thing. Because, the liver rises on the left. You see that on the tongue also. If she had Shaoyang symptoms, like do you have any migraine headaches or any nausea? Probably not, yeah. If you have a lot of heat in the Jue-yin, you can clear it from the Shaoyang, but I'm not seeing these symptoms, so I'm not sure. Okay, so let's... Okay, so tell us a little bit about what you have.
What I have?
Yeah, or what you feel, actually, not so much what you...
I get palpitations.
How often?
It's a funny thing, really. When I'm still, I notice them. But
When you're still, more when you're still.
so
Okay,
maybe they're there all the time, and I don't
okay,
notice
okay.
them. Or in the afternoon.
Afternoon time, when she's still, more yin states. Okay, and so you don't normally feel them when you're walking. You may feel them afterwards, right, when you're resting more.
I sit still, which I don't do very often.
Okay, and do the palpitations, are they accompanied by anything else as well? No. Okay, so you never feel hot more when you have palpitations, or more cold, or more...
Maybe a bit hotter.
Maybe a bit hotter.
Nothing really
Okay.
pronounced.
In general, do you tend to be more hot or more cold?
Hot,
More
but
hot.
it can be a bit cold around the edges.
Okay.
sometimes.
How's your digestion? Good? Okay, what about your sleep?
Yeah, good on the whole. I mean, I wake up a bit, but I go back to sleep again.
Wake up, what time?
Usually about an hour after I go to sleep.
Which is, what time?
11 o'clock.
So you go 11 and you wake up at around 12?
Yeah. No, I usually wake up about 11:30, and then I'll go back to sleep again.
Half 11 is half past 11, yeah? It's, yeah, I just, half past 11. In Ireland, it's the other way around. Oh, I just didn't pick it. Okay, so this is gallbladder liver time, right? So we're looking into that. Okay, any nausea, any headaches, any migraine headaches, menstrual cycle, pretty regular, any PMS? No. Okay, any shortness of breath, hypochondriac discomfort, chest discomfort. When you feel palpitations, what do you feel?
It almost makes you feel a bit fearful.
Mhm.
It's sort of high in the chest, and
Mhm.
there is a little bit of almost like anxiety.
Okay.
with it.
And do you also have like rushing beats afterwards, or what does it feel like? Does it feel like fast beats or skipping beats or both?
I say it feels like a bird in a cage trying to escape in my chest.
Okay, so like something fluttering there.
Yeah, it can be fast and it can be slow, but often when I start to feel it, it gets more, I guess.
Right. And again, the diagnostics is what?
They said that it's a genetic condition that doesn't affect the functioning of the heart. So my mother and my grandmother had it as well, and it started about the same time of life.
And it's not just premature heartbeats? They didn't say that? Maybe?
They thought it was atrial fibrillation when they
Right.
first saw it. So this has got a lot better.
Mhm.
It used to be all over the place,
Okay.
very, very changeable.
Okay. So now you're just presenting premature heartbeats, which is something acupuncture could work really well for. So I would probably do, again, we have some hypochondriac, not hypochondriac, we have some, you said some tendency to be more hot and then cold in the extremities, again, liver stagnation symptoms. I'll take the pulse and tongue in a minute. So I would definitely also do like a Jue-yin treatment here. So, but also, again, some red complexion and tendency to be hot. So on the one hand, clear some heat. On the other hand, maybe nourish some yin. So PC6, kidney 6 actually could work nice here, and PC6, liver 2, kidney 6. I would do, I don't know why, let me check your pulse. I feel like heart 7, spleen 6 could also be good for you. So we're going to do a whole, can you remind me your name? Kathy. We're going to do a whole treatment for Kathy, and if you want to stay. And those of you who want to go, you can go, because that's the end of the conference. But those of you who want to stay, see what results we're getting, then we'll be here for another 20 minutes. Yeah, I can definitely feel the skipping beats. Very easy to feel. How
The
about
weather, it's really affected by the weather. If it's really, really windy,
windy?
it gets worse.
Okay, do you know the relation between Juwayan, what the climates in the channels? Are you aware of that? Okay, what's the climate of the Juwayan? Wind, right? So windy affects it more. Okay. So let's have you lie down. And can you tell me your name? Deb. We're going to do yours sitting up. Is that okay? Okay.
I've got a taxi at past.
1:30. Ooh.
Does that make it too hard?
Let's do 15 minutes and see. I don't know.
Do you want my tights on?
If you can, yeah. Sure, thank you. Yeah, right there.
Yeah.